The ability to breastfeed after a breast reduction is variable. What I would say is that even in people with normal breasts that haven't had surgery, there's probably about 30% of the population that can't breastfeed. And a lot of those are women that have very, very large breasts because it's just very, very awkward and very difficult to breastfeed with huge breasts. And so the surgery itself can reduce that ability if you were able to breastfeed. The magic number is probably about 30%. Probably about 30% of women have a reduction or an inability to breastfeed. What I would say is that if you've had the surgery and then you have a pregnancy and you want to breastfeed, absolutely give it a go. You may find that you can breastfeed, but the supply is a little bit less and you may need to top up with formula. You may find that one side's really good, the other side's not quite as good. So definitely a little bit of trial and see how that goes. The only operation that means you definitely can't breastfeed afterwards would be if you were to have nipple grafts for the surgery. So the surgeon should have explained that to you, and that's because of the size and the position of your nipples that's a technique that would need to be performed to get you to the size that you are ideally after. And unfortunately, the biggest downside of that procedure is that you definitely can't breastfeed afterwards.